There she is. Hello, Cheryl. How are you doing?
Hi, Sherina. I'm fine. How are you? Nice to
Fan-
see you.
Fantastic. Great to see you again, too. And you are in pink.
Yep,
Both in pink.
be the new color.
Good choice. Great choice. People are going to think that we had a bit of a dress check last night. So great
No,
taste. Great taste. But no, fantastic to see you. And, I'm so excited that we're doing this webinar on your favorite treatment.
Endymed.
Endymed, and I'm so excited because I haven't seen you physically for almost 12 weeks.
No, the end of March. Well, actually, almost the middle of March because I was supposed to be going on holiday on the 19th. So yeah, I worked till the first 2 weeks in March. I haven't seen you since then.
Oh, we've been seeing each other virtually, and thank you so much for keeping in touch. It's been wonderful seeing you this way if I can't see you physically. Well, look, today we decided that we're going to put together something really special for patients, for colleagues, and for anybody who just wants to learn more about your favorite. And can I show you what we've done, Cheryl?
What? You've brought them all.
I've got them all. I've got all of them here.
Amazing.
Shaper, I've got your intensive, your FSR is over there. I've got your eye shaper in the corner. So
Oh, I haven't seen them for so long.
they're all here. You can almost reach through the screen and touch them, Cheryl, but only a few more weeks to go. 4th of July.
Perfect.
Not long, but not long. But look, I'm so excited. So why we decided to do this is to share all your knowledge, your experience, your expertise, and just all about the science of this wonderful technology. So yeah, we're going to crack on. We're going to cover a couple of things. But before that, could you introduce yourself, Cheryl, to everybody?
Hello, everybody. I'm Cheryl Marshall Williams. I'm an aesthetic nurse at S-Thetics. I have been there for 3 years. Time's gone really quickly. I've been in aesthetics for 18 years this year. It's amazing. The time has gone really fast. It's perfect for me, aesthetics, because it's given me a balance between the things that I love nursing. I love nursing, and I also loved looking after my patients. And I love health and wellness and beauty and all the holistic sides of it as well. So putting the two together was a perfect blend for me. And yeah, I've been a nurse for 40 years, so that's really crazy as well. Yeah, and so I'm here today to just talk about how we use Endymed in aesthetics. Yes, aesthetics.
Fantastic. And I'm going to add to that as well, Cheryl, because you've got so much experience in medicine as a whole and as well as aesthetics. But also, could you just share with us how long you've had experience with Endymed itself as a technology, as a platform?
As a platform, I've used Endymed for 10 years now. Endymed came into England 10 years ago. It got its FDA approval in 2009, yes. And in 2010 it came in at ACE or FACE, I think, one of those two aesthetic treatments, and from there on I've been using it. So I've seen it evolve from just having 2 handpieces to now having 5 or 6, and it's great because it gives the opportunity to treat anybody for anything, from eyes right down to stretch marks on the legs or the buttocks. So we have amazing technology in the platform, and it works really well.
It does work amazingly well. And, I love watching your patients when they finish having a treatment with you, whether it's tightening, whether it's FSR, and whether it's the intensive, everybody seems to float down the stairs with you. So I consider your patients very, very lucky to have you. I consider myself very fortunate to have the opportunity to work with you. But thank you. I would say, just to add on to that, so that would make you the longest running Endymed practitioner in Europe.
One of them, yeah. Yeah.
You'll be very humble. Ladies and gentlemen.
Yeah, I think when it first came through, there were 2 machines in England, so there are 2 of us somewhere. But yeah, that was amazing. The machines from Israel. Yeah, and it was just an amazing experience. And 10 years ago, aesthetics was just changing and developing, and things were just it was such a it still is a fast moving industry, but then it was just like, you just had to keep ahead of the game. And Endymed was a game changer in the fact that, we did have radiofrequency. Radiofrequency had FDA approval, I think, in like 2004 for facial rejuvenation. But it was like one beam unipolar radiofrequency,
Right.
which scattered a bit and was a bit uncontrolled in a sense, and quite painful and hot. And then we had bipolar, so we had 2 beams of radiofrequency, which was better, more controlled. And then Endy came and gave us 3 beams, so deep and wide and perfect, because we get to the same therapeutic temperature as all the others, but without the patient feeling like they've got to 41, 42 degrees in their skin. And so for that, it's a very comfortable treatment to have. It's only when we get to things like the microneedling, which are the more intense treatments, we need to use some local anesthetics. And so there's a little bit more discomfort. But other than that, it's an amazing and a very relaxing treatment. People fall asleep, basically.
I fall asleep when I think of you. So, it speaks volumes for 2 things. Number one, practitioner. It speaks volumes for the practitioner, the way that you do it, the way that you have control over your handpiece. And, just to give everyone an example of what these things look like. So, ladies and gentlemen, we're not in the clinic. As you can see, we're still virtual here in June now. But we have decided to bring the clinic to you. So attached to this.
That's amazing.
This is yours. So attached to this, we would normally have a portable device. The device is just so elegant and so streamlined, and it's in Cheryl's suite back at the clinic, and that plugs in. And through that, really just plugs into the wall. So it's a connector piece, and then it delivers this non-invasively, it delivers the energy through your 3 deep system. And those are your generators, in which it's delivered, and then it's externally used on the skin. So it's all external, nothing penetrates. This is the tightening and contouring. And so it's a non-invasive skin tightening treatment using radiofrequency technology. So that's what Endymed is. This is one of our handpieces. And just to show you what...
Great, because they have the handpieces change size and shape, so we can get underneath the brow, and right up to the eyes. Thank you. It's my magic.
Your assistant. So actually, Cheryl, there we go. So that is your eyes, and that is your face difference. So you can see. Do you mind telling everybody the difference between? Can you tell everybody about the generators? What makes 3D so unique compared to how it's evolved over the years?
In the sense that, as I said, because it's got the 6 generators, it goes very controlled deep into where the collagen and elastin is stimulated. So we get heat, because Endymed is radiofrequency is heat, energy, and because of the depth that it can go with the 3 layers, so that's why it's called 3 deep, 3 layers of skin, it goes to where collagen and elastin is stimulated from fibroblast cells. So we can contract collagen that's there to give you more of an instant lift, and we can stimulate new collagen. And that's the process. So it takes 3 to 6 months to get the end result. So Endymed is a treatment that is ongoing. It's to get skin health, glow, lift, tighten, all those amazing things. But it's not a one-off treatment. It's a treatment that we do over a program or a course of treatments, specifically to help keep that collagen stimulated. And then we keep a maintenance treatment, which later on maintains that, because we are all aging. Whatever we do, unfortunately, we all still have that to deal with. So we're not there to say it's anti-aging and it's going to take you back 10 years, whatever. But what we are there to do is to make the skin healthier for longer.
Yes.
And that's only a good thing. And it will show in the skin from its glow, its lift, its tightened. And that's why I like it.
You're absolutely right. What it does is, anti-aging is a funny word, isn't it? And you and I share very same philosophy. I believe in maturing as well.
Age less.
Age less, but also age positively and dynamically. And one of the things about Endymed, you spoke about a number of things. You mentioned immediate tightening, because what you're doing is we're really using the energy from this platform to heat the skin non-invasively with a contact on the skin. And you use a gel, don't you, to get that contact?
Gel.
So you use a gel which is applied on the skin. It's almost like an ultrasound gel, but slightly different. It's specific to the technology. So, a bit of advice to the men and women out there having it: don't book your blow dries before you come for the treatment. It's true, Cheryl, right?
It is, because the gel goes on all thick, but as it heats up, because we do take the temperature to 41 degrees, 42, the gel gets thinner and it does go everywhere. I do try and not let it go everywhere, but yeah, it does.
But it's so worth it, because, as you said, you're gradually and slowly during the course of the treatment, which takes about an hour and a quarter for the full face, right? We take about.
Yeah.
And what you're doing is, if you look at the temperature of the skin normally, Cheryl, before you start, it's about what, 34?
32, 33, yeah.
32, 33 degrees. So this is you and I just sat here, and you're using this gradual heat. I mean, I love the heat. I would describe it as a deep hot stone facial, just getting really nicely warm. And you're taking it then gradually up to that 41, 42, is that right?
Yes, that's right.
And how do
Which
you
is the therapeutic change in the skin for stimulating collagen, because that's what you want to get to. So we use a thermometer, which is a digital thermometer, and it tells me what that temperature is below the skin, because the patient doesn't feel that as that degrees, otherwise they'd be jumping off the bed. It's quite hot, but it's deep in the skin, so that's why we call it 3 deep. It's where the temperature goes where we need it to go at that level for the collagen stimulation, and that's what makes the difference. And so we maintain that temperature. The actual machine is very intuitive. You say which area of the face you're treating, it works out. It counts your passes for you, which is great, because I talk too much and I would never be able to keep track of the passes in my head. And yeah, so it allows you to treat each area. So you treat the cheek, then you say you want to treat around the eye, so it changes the temperature, it changes the depth. So we don't have to worry about how deep it is, where we are. It's all worked out there. But you can see in the skin when it's got to the right temperature. You can feel the skin change. You can see it change. And that's the great thing about it.
Thank you. No, thank you for sharing that. So you're talking about what we look at as clinical endpoints. So as practitioner, you're looking at your clinical endpoint. So you mentioned the temperature. That is one clinical endpoint. So you're aiming for like 41 to 43 degrees comfortably in your patient. So that's checkpoint number one. Clinical endpoint number two, you said you're mentioning you can actually physically feel the change in the skin. And I know when you've treated me before, you've actually sat me up halfway during the procedure with a mirror and you say, go on, Sherina, have a look. And honestly, your face
you can see it
immediately. So there's a physical lift to the face. And I think we measured it on one of your patients one day, and it was close to about 4 millimeters of change. And that's very consistent with what we read in the literature.
And yeah, the 4 millimeters of change is also what you aim to get at the end of your treatment. So after you've finished your 6 and you've come back for your maintenance and stuff, that's the change we want to see. So it's sometimes a subtle change. Patients are like, I just look better. But what they can also always say is that I can feel my skin feels firmer. It feels like, I have all sorts of funny things say to me, but they feel as if the balloon's gone back in. It feels as if there's they've got some structure underneath, and it's not loose and it's not hollow. And so their makeup goes on better, they look better, their skin is more glowy. And it's that subtle lift, because most people come and say, can you just lift this up a little bit for me? Which is not a big lift, but if you can do that and maintain it, then you keep that change.
Absolutely. So that's number two, the physical change, one that you can see, one that you can feel. And then you also mentioned that because we're heating up the skin very gently, gradually to get to those 2 points, we do see a little bit of mild redness in the skin, which is again a desired endpoint. So those you would summarize as your 3 clinical endpoints. And most devices that we use have things that we aim for as practitioners, right?
And the patients, the redness, unless you're asthmatic, so some people might think, oh, well, if I'm red, can I have this treatment? And you can. The redness is around for a few hours, sometimes even less than that. But if you are somebody who's more prone to red, it might be along for a bit longer, but it doesn't irritate the skin. It doesn't create an inflammation in the skin. So it's not going to make that worse for you. It doesn't disturb broken capillaries or anything like that, because that's another thing. People say, oh, I have a lot of broken capillaries. And it might be that if that is the case, and it is quite a lot, then we treat that first before we do the ND. So ND is, can merge with lots of other treatments. It's not that it's a one-off by itself treatment. And so depending on your consultation, depending on what the patient really is looking for now, because they've come to you with something now, but we talk and we find out what's going on, and it's that you build that relationship with your patient, so you can say, well, let's do this first and then we'll do that after. So it's quite nice. They have a plan.
Now, planning is everything. We love planning in the clinic, and I know that you believe in the whole consultation process. I'm a stickler for the whole consultation process. So that's really key, to really identify what someone is really wanting to get out of their treatments with us, what their main concerns are as well, and also what the potential is. So I think our patients sometimes may not realize the potential of these treatments and the opportunity that it can give them to assist in their aging process as well. I certainly have experienced some of the older technologies because they were the only ones around when I first started in medical aesthetics, and they were great. They were good. They got the job done. But I have to say, over the last 10 years, this has certainly been the more comfortable. And 5 years down the line, I've been having this at the clinic for 5 years, 3 years with you now, maintaining, and I feel like my skin is in better health than it has ever been for the last 5 years.
And we can see that with our VISIAs, and you can look at patients and you can see that sometimes if you look at yourself every day, you don't always see the change. But when you look back 2 years or a year and think, actually, I don't look any different.
Yeah.
I can sometimes look better. But even if you don't look different, you think you haven't aged for 2 years in that process. And that's an important thing, because, if you're somebody in your late 40s and 50s, if you don't look after the health of your skin, you will see that change in 2 years. And so it's great to be able to maintain even. That's a good place to start, and then we get it better.
Completely agree. And we see patients of all ages. For me, I'm not an ageist. I don't believe in that number. I think begin anywhere is a great place to start. And we were chatting the other day about preparing our patients pre-Endymed, but I just want to go back to the technology again, because I remember when I first heard, before I bought the device in 2014, and I heard the presentation by the lead clinician from Israel, where the device is from, and the science in which he presented it was so elegant. And to bring something in that's FDA approved, which is the highest level of clinical standard that you can get in the technology, I was blown away by the 3D technology, because the way that the energy waves come out, they bounce off each other, and that's how it goes. Oh, just like that. Thank you, Cheryl. I love it. Well done, Cheryl. Thank you. So, ladies and gentlemen, if you can see the generators, and the energy goes from one generator to another, ping pong, and that's how the energy goes deeper and deeper. You can see where Cheryl's finger is. It's actually, it's bypassing that top layer of skin, which is the epidermis. So you don't get any trauma to the epidermis per se, because it's going much deeper where that target cell is. It's called the fibroblast, and that is the cell that triggers collagen production. So we love fibroblasts. We want to trigger it. And you can see bipolar means a slightly older technology. So you can see what that does. And 3D has more bulk heating, not in the epidermis, but more where it needs to get to. So the beauty about the science of this is the evolution. Everything is getting better with time. And the beauty thing is with the gel, so comfortable. Thank you, Cheryl. Right on. You can tell, ladies and gentlemen, that Cheryl and I love our toys and our science, and we have everything right on touch. And so, no, I love that presentation. And I remember when I saw the science, I just thought I have to try it myself, which I did. And as soon as I tried it, I got it. I got it straight away, and our patients love it. And so we were talking about the preparation of the patient, because obviously the target is water. That's what a radio wave energy looks for. It's looking for water in the tissues. So is there a benefit then preparing our patients for this type of procedure if the target is water?
It's very important to have good skin health. And good skin care products to get the skin healthy. And also, in specific for the water, it's great to drink water, because a lot of patients do all those other things, but you say, do you drink a lot of water? And they go, maybe 1 or 2 glasses a day, which is not what we need. So you need to be able to drink your 1.5 liters of water, if you 2 liters if you can. Some people are like, I hate water, I don't like it. I always say, try and then eat fruits and vegetables that hold a lot of water. In the summer, it's easy to do that. Eat watermelon, eat grapes, have cucumber. Don't say you have to go and eat lots of greens all the time, but you can work a way around it. But if you're somebody who's also drinking a lot of coffee and tea, then, and we won't talk about alcohol, because all those things dehydrate the skin. So you always say, if you drink a cup of coffee, you should have a glass of water to kind of balance it out at the same time. And you will get a better result if you are hydrated.
No, I completely agree with you. Hydration is good for us anyway. And I know sometimes I need a little bit of prompting, to drink a little bit more water, especially when you're going fast. And especially I have found, Cheryl, because I've been speaking to a lot of patients over the last 2-3 months, now that we've all gone into lockdown, a vast number of patients whom you and I both know who are already on skincare, and they're on our strategies, they're on our treatments, and also some of the new patients whom we're yet to meet still. Everyone's going more dehydrated. And I think there's just been increasing amounts of transepidermal water loss. People are a little bit more anxious or stressed just because there's an underlying anxiety. So now's the time more than ever to get everyone to up their regimes, right? Drink more water in preparation for your treatments.
Definitely. And, we are spending, it's summer, so we are spending more time outside in the garden. And I think, but in our normal old way, we probably got to the garden on the weekends, but now we can be there all day. And it does dehydrate the skin. And so together with your sun protection, make sure that you are using your vitamins, your antioxidants, and they also will keep the skin healthy. But yeah, drink. It's important to drink water together with everything else. And you make sure your products include some hyaluronic acid in it somewhere, because that's also what's going to give us the hydration on our skin, as the topic on the skin.
Perfect. I completely agree with you. And so, I have seen your diary. I've spoken to a lot of your patients, and they're really excited. And so I will now continue to say to them, you better up your water intake. I know that they're all on hyaluronic acid. I just know that they are, because hyaluronic acid is a water lover. It's a water scavenger. It's going to bind to water 1,000 times than any other molecule known to mankind. So if you think about it, if you're drinking more, which is going from the gut in, and you're using hyaluronic acid topically, it's just that sweet spot, which is right in those layers that you need to target.
Yeah, exactly where we need to be. And together with all the other things, make sure that we're getting enough sleep. I know a lot of people are having problems sleeping and a little bit more stressed. So all those things create that inflammation in the skin. So we just need to be gentle with ourselves.
Yes, kindness is cool. Be kind to yourself as well as others. But it's interesting. Now we're going a little bit more away from the technology. We'll come back to the technology, because we were talking about aging the other day and the intrinsic and extrinsic factors. Could you mind just expanding on that, the two different topics?
But intrinsic is, it's genetic. It's what's going to happen with you. It's been within our DNAs. It's just our natural aging process. We can look at our mums and see how they aged, our grandparents. We basically do the same thing, unless we stop different things along the way. The extrinsic aging are things that are out there. So we all know about sun damage and photo damage, but there's pollution, which thankfully there's much less of at the moment. But when we get back out there, it's going to go back up again. in this time, we have a lot of stress. So we need to look at stress. Diet, we're not always eating the best things. So we're having some binge dieting. Alcohol, we're probably having maybe sometimes an extra glass a week or something of white wine. All those things, although they're little, when they put together, it's a lot for the skin to have to deal with. Mm-hmm. So the other thing is also we spend a lot of time on our screens in front of our computers and our phones, and so there's a lot more blue light, and blue light is as damaging to the skin as sun damage and pollution. So to think you're home all day and you're not going outside, you still need your SPF, because you still need to protect your skin from the UV damage that comes off of all these screens, and we're living on these screens. So yeah, that's a different way to look at it. But yes, I think that kind of, when we combine the two, our natural aging and all the other aging processes that go on, we just have to be more aware. And so do things that make a difference. So yeah, obviously eat more healthy, because extra sugar goes to glycation. And glycation gives you all those fine lines and wrinkles and crepey skin around the eyes. Sun damage, we know the effect of sun damage on the skin with pigmentation. And so we have to kind of balance the two. So you have good skincare that is going to work on, make sure you have your antioxidants, your peptides, your collagen stimulators, your growth factors, your SPF, all those things that are important every day. Internally, we need to maybe think about using things like nutraceuticals, which are drinks or tablets in some way that have gut health and stimulate collagen from the inside. That's not a machine. And yeah, just find some time for, I know everybody talks about meditation and wellness and being at peace, but those are the things that do restore and reduce the stress. And the stress is not a good thing for anybody. So yeah, it's not a good thing physically, it's not a good thing for your skin, for our mental state. So whatever we can do to reduce that is a good thing.
Thank you. No, and thank you for saying that. I think we all run fast sometimes. We've been running slower with everything that's happened, Cheryl, but I love the way that you have emphasized that, because we as a team emphasize that to our patients every day when we treat them, when we consult them, when we show them with their visias. And I know that you were part of this process, because when we consulted patients at the start of this year, even towards end of last year, and we were asking them, do you remember, can you rate your stress levels? And these are amazing patients of ours that, they're looking after their children, and they're looking after their families, and they're looking after, dependents, they have careers, whichever. And most of our patients, I would say close to 98% of our patients at that time, responded from 0 to 10, with 0 being nothing to 10 being the highest, that their stress levels are running close to 7 to 8 out of 10 normally. That's high.
It is high, and it's in a strange way for some people, because they've lost that stress. In one way, they're stressed because they don't know how to deal with not having anything to do. But for some people, they've remained stressed because working from home is sometimes as hard or even harder than working in the office, and trying to get that work-life balance in the house, and also mums who are having to school their children as well as work, as well as look after the family. It's a different kind of a stress. So it's just a case of standing back a little bit and seeing what's happening and being aware.
Yes.
Don't let it just go.
Take over. Yes. So it's thank you for sharing, those two aspects of aging, because people need to know. And, as you said, to summarize, you have intrinsic factors, which is your biological clock, which is your DNA. And, if you've got good genes and great genes, then fantastic. You've got an advantage already in life. And then everything else is what we call the extrinsic factors, the lifestyle factors. And patients don't realize that if you look at 100%, only 35% of our aging is dependent on our genes. The rest of it, 65%, is dependent on the lifestyle, which is the epigenetics. There's things outside of our genes, but actually more in control. So we're actually in control. of most of our aging patterns. So with little changes, you mentioned the sugar, the glycation, sun exposure. We've had some fantastic weather over the last couple of months, and all these little things, cigarette smoking, we see less of that, but a lot of people more smoking pipes, cigars during this time to celebrate being outdoors. And all these little things, you know, do play an influence on this, because it's like an anti, it's fighting it. So just by changing it, it's going to help Endymed take over, doesn't it?
Yeah, it does. And that's what we want. We want to get the skin lifted, uncontoured, and glowing.
Yes, absolutely. But no, thank you. And, you know, I can't wait for you to come back and share all of this knowledge once again with a lot of your new patients that you're seeing. So I want to move on to more of the technology, because one thing about Endymed is it's evolved. Even the original platform for tightening and contouring has evolved over the years, right?
The handpieces have changed.
Yeah.
It started off with the handpiece that you have.
Okay.
Your hand, which is the fine. And then we had a smaller handpiece that was in between those two. So we don't have that one anymore.
Yes.
And so now those are the two basic ones that we use for the face, neck, and eyes, and the décolletage. So that's what we call TC, tightening and contour. And then we can go deeper into the skin. But before that, also with just the tightening, we have something called V-shape. Have you got our V-shape?
I didn't bring V-shape today. I had like 2 hands, so I grabbed all Tell us about the V-shape, because
the V-shape is a great tool for jowls and for the submental, just below the chin, because it heats and it helps work on the actual jowls along here, so it gives you back the structure of the jawline, which is a great place, because if you get that V-shape back, which is usually, they say, aging is we get the V-shape going upside down, so we get more of the width at the bottom, but for younger people we get the V going up, and so that's what we want to do, to have that lift. So the V-shape works specifically just in this area and just below here to help with the fat below the chin. So that's a great connection. So you can do V-shape by itself as a course of 6 treatments, or you can do V-shape in combination with the tightening on the face. So we have choices.
Love the versatility, and it's such a versatile device. And
and it's just changing it around depending on what you want, and for a lot of women the jowls are what really bugs them, because that's what they see when they look in the mirror. So it helps with that tightening and with the glycation and those lines along here. And then if we want to go a bit deeper, we have the fractionated skin rejuvenating, which is the FSR. So that's it. And so don't know if you can see their little the handpiece that fits on that. So this works in this way. So you can see this one, and it's just got like little dots. So that's why it's fragmented. So it goes down in beams. So that's the cover goes on top of that.
Yes. I don't have your handpiece, but you've got a picture of the handpiece right there.
So it's because it's an individual treatment for a patient. So we use a new handpiece for the patient, but it goes, whereas the TC goes round in circles and we circle around the skin, with FSR and with intensive, we go in columns into the skin. So the difference between FSR and intensive is that FSR,
that's great, Cheryl.
Looks like the handpiece, the head looks like this, the individual head that we clip on, and each of those dots are a beam of radio frequency that goes into the skin, but it doesn't break the skin. So although it's a deeper penetration, you have no breakage of the epidermis. It's the difference with the other fragmented treatment, which is the intensive, is that they're needles. So
just goes back to the fractionated skin resurfacing. I love that picture that you've got up there, because it's fractionated means that it's not treating 100% of the skin.
That's right. So people have heard of things like Fraxel and stuff, but that's just a name. Fragmented treatments of any kind means that you treat one spot, the next spot's not treated. You treat one spot, the next spot's not treated. So although it's an ablative treatment, it's not a full ablation so that everything's not treated, because then the downtime will be much longer because the body needs to heal a wider area of skin. With the fragmented radiofrequency, those beams that are not, the areas that are not treated are fine, so they heal much quicker.
So brilliant.
And so even though it's a downtime in the sense that you leave quite red,
yes,
and you do get a little bit of dryness,
yes,
the downtime is like a few days
yes,
for most patients. And it's perfect for around the eyes,
yes,
because that's where we pick up a lot of those fine lines.
yes.
And so we call it Endymed treatment. So we can work, even though it's
You can actually stretch the skin
and go underneath the brow, so we can give you a lift of the eye, above the brow, underneath the brow, and underneath the eye. So if you've got lots of fine lines and wrinkles, that's a perfect place to treat. You can treat in the center for the 11s, as they call them. So it works perfectly also with other treatments. So like if you were doing neurotoxins, it works great for that, because if you stimulate the skin and your skin is healthy and already lifted, when you're treating with neurotoxins, you get a much better result. Yes. And a much more natural look around the eye. And some people actually then don't need neurotoxin because they've already got that lift that way. It's also great for dark circles underneath the eye because of that deep collagen stimulation that you get.
I think it's a beautiful piece of technology. So again, with the Endymed platform, just to summarize, you know, what you were saying, Cheryl, you've got your tightening and contouring, which we've talked about, which is all external. And then you've got the fractionated skin resurfacing, which we use very, very frequently around the eyes, just really because the head can be positioned so beautifully, obviously not treating the eyelid itself, but we stretch the skin down and you can really get to, you know, far-flung places, like the very thin, fine skin on the eyelid, because it goes to just that 0.1 millimeter of depth, and it just treats that every single time. And I know you do a protocol of one treatment once a month for about 3 months, and then you just wait for that collagen to just kind of leave it alone. We've triggered it a few times, and it's like a little child, and you just got to nurture it with some great topicals and time and a little bit of love. Sun exposure needs to be obviously, you know, discussed and maintained. And then we wait and we evolve, and you continue your maintenance.
And the maintenance can be just with TC, which is tightening. So they can, because that in itself also, we can work specifically just around the eyes. And so that's a great combination of deeper treatment with maintenance of not so, you know, with a much more comfortable treatment if that's what's good for them. And then they just do one treatment every 3 months as a maintenance, and they just keep going. And then maybe once a year, go back and do some deeper collagen and then continue. So you can plan whatever it is they need. And if they need to do more of FSR, then you do more.
You do more. I completely love this treatment blending with the Endymed procedure, which is a fractionated, and the tightening and contouring. I think it works perfectly. And at some stage in all of our lives, I think we all need an Endymed or radiofrequency type treatment, because the collagen is changing. We do need bulk heating.
So we stop creating as much collagen in our late 20s. It's sad to think that 25 is like, not that we don't create anymore, it's just we have less and less. So by the time we head to 40, we've had 20 years of less collagen stimulation. And so we need some help. So there's no age group for ND. I say, you know, it's not like, you know, sometimes people think, oh, you know, it's too young to start doing something like this, or I'm too old. So if you're older, yes, it will take longer to stimulate the collagen because there's less there to work with, but it will still make more of a difference than not doing anything.
Yes, completely agree with you. And I remember when we first started doing radiofrequency years ago, our patients generally used to be maybe a little bit older, you know, because that was the only devices or technologies that we may have had. Whereas now with the evolution of the devices and the technologies, and also the more awareness that we have of the potential, and our patients are actually coming a little bit younger. They're all ages, but I always say we've got more healthy, more collagen in our 30s, 40s, whichever. Start then, begin anywhere. So therefore you're actually getting more potential of the actual result itself. So I know I started having ND with you well, 3 years ago with you, 5 years in total with the clinic, because it was one of the first devices, actually it was the first device I brought in from a technology. We had Endymed, we had Visia, and some skincare topicals, which were excellent. It feeds, and my hands, and that's all I had. And it's still one of the top performing treatments, and I know you're fully booked with it.
It's still one of the most treatments that I do every week.
It is, and I know you do a lot of this every week.
Intensive. Oh yes, that's the very special treatment. That intensive is the most intense, and the name is correct, of all the Endymed treatments there are. It is a combination of radiofrequency, which is pulsed radiofrequency, with microneedling. So at the tip there, when we have, it's an individual head for each patient each time. There are 1,000 things.
25 needles. So
yeah,
we would have a tip.
I don't think this actually shows you the tip, but anyway,
but
the tip goes on. It's needles, so it's a sterile head per patient. So each treatment we change that. Each treatment allows us 1,000 shots, which is an amazing amount of treatments. The head has 25 gold-plated, non-insulated needles that are very fine and very exquisite. And they go in and out of the skin, pulsing in and out really easily. And patients are amazed that I've actually stuck 1,000 needles between their face and their neck, and there's absolutely no bleeding, because mentally, microneedling takes us back to the days of rollering and lots of blood and stuff, but there's nothing like that. There might be an odd dot, but nothing. So it is hot because the heat is from inside out. And so by the time we get to the end, they do feel the heat. It's not that it's painful, but they feel heat. Yes. And the heat comes from inside. So so by the time you get to the end, they feel the heat. In the beginning, they don't really feel it too much. The great thing is that we can change the length of the needle depending on where we're treating on the face. So we tell the machine we're treating the cheeks, it will start off at 2 millimeters. We tell it around the eyes, it will start off, we can turn it down to 0.5 millimeters. We can, if you're treating stretch marks, you can put it up to 5 millimeters. It all depends on areas that you're treating and the needle length that you require, depending on the skin that you're treating and what you're treating. So in the same way, if you have somebody who is with a thinner skin, you might change that as well, because you think that's probably a bit much for them for their first treatment. So you're in control. And then it's great for the patient. But the whole area, right up underneath the brows, around the eyes, the forehead, everything is treated. And so you get that lift all the way up, which is the best way.
It's the best. I mean, it's beautiful just thinking that one platform can give you as a practitioner so much potential for pretty much every patient that you see. So it's not even a case of like, oh, I wonder which one. There is an opportunity for every person that's coming in. Like, I know there's an opportunity for me to have tightening around my eyes, fractionated skin resurfacing using the other handpiece, because it's also safe for all skin types. And that's the beauty about radiofrequency. It's colorblind. So I feel so confident about the technology that, you know, I can have tightening and contouring, fractionated skin resurfacing, and I know at some point in my aesthetic aging, I will be having intensive as well. And the beauty about intensive is, you know, as you said, when we first started doing genuine derma roller, again, it was the same company, Aesthetic Care UK, you know, trained us and taught us on the genuine derma roller, and now here we go. We're seeing microneedling go next level. And I remember first learning about microneedling back in 2005-07. Pretty much. And I remember when I first saw the technology with the needles so elegantly coming out of the device, and, you know, from a practitioner to use it, it was beautiful. But I knew when I first opened the clinic, I couldn't have everything, Cheryl. You know, I had to check what I needed right from the start, but I had my eyes on this, you know, the whole time, because one thing is skin rejuvenation, which, you know, you and I both share in common. We love that, skin revitalization, but also from a scar treatment point of view. Scar treatment.
Acne scarring, stretch marks, even post-surgery scarring can use ND4 to help with that.
Everything. So it's been amazing as a clinician who has a clinic for me, being able to choose and prioritize what handpieces I wanted, but I also could see the potential and just wait and, you know, be able to say to patients, this is coming soon. And I remember when I brought this in just over 3 years ago, and then all of a sudden you came and, you know, took over intensive, and it's one of the top treatments that I would recommend just for fine tissue revitalization. It's just exquisite watching those results come through. And I'm blown away because, as you said, you know, you've got 1,000 pulses with those 25 gold-plated needles. It hits the target, delivers the radio frequency and the needling. Because of the heat, you coagulate, you don't get any bleeding. Your patients
heating.
Because your patients are hot because they come down going, whew, I'm hot. But I have to say, everyone's comfortable with you, Cheryl. They float down the stairs with Cheryl Marshall Williams. It's a skill.
Thank you.
You're welcome.
And it's a great machine to work with as well.
It is a phenomenal machine to work with. And, you know, on that note, then I think we've covered all the handpieces beautifully.
There's the body.
Ah, body.
Yes, we have a body handpiece as well. And it is great because you can use it for tummies, for tightening, for loose skin after babies, for loose skin after losing weight. You can use it for legs, all the way up for the buttocks, for lifting and tightening, and some cellulite remodeling. And also the smaller piece, the small one that we use for the V shape, which you don't have, we can use it for arms. So we can do underneath the arms as well if that handpiece is too big for the arms of the patient. So again, because the handpieces are so versatile, not that one, the other one, which you don't.
I haven't put that one in.
I haven't brought that one in. It's the one that we use for the V shape. So it's the so it looks like the body one, but smaller.
Mm.
And so you can use it for tightening below the arms, which is great for a lot of patients because that's where we have a lot of, as we get older, unfortunately, that's as much tricep dips as we do, we still always seem to need something to tighten up underneath the arms.
And you know, this works so well for maybe a slightly larger surface, and then you've got your other baby shaper, which is actually your V shape, which you can actually use. And I know our patients get great results with this, and we've got some fabulous case study results already right from day one from the tummy, and perfect from that, you know, post-pregnancy tummy, or even, you know, we also lose laxicity, you know, even if we don't have children or we haven't had pregnancy or any scars or anything like that, skin just generally loses elasticity. So again, I know I love having those treatments just because it makes me feel tighter, more contoured before I go on the beach, before I go on holidays. And it feels like you are just having a most glorious suntan without the suntan, I have to say.
Just a warm massage.
So these are all your handpieces, and I have to say, you know, from the versatility of the platform, you use all of these not every day, but you use all of these all the time.
I could actually say there are very few days that I don't do ND.
I would agree 100%. You have
at least there's one ND treatment in most of my days.
There is.
And some days there are 2 and 3.
I can guarantee you, Cheryl, you've got lots of ND coming up in the next few months. So here we go. You know, so these are our fabulous FDA-approved, non-invasive radiofrequency skin tightening treatments. We've got tightening and contouring, all external. Fractionated skin resurfacing, really ideal for those kind of crepiness around the eyes, the ND blep. And then at the end, we've got that microneedling with the radiofrequency for that deeper tissue remodeling, scar stretch marks, and also skin revitalization. Question is, we're at home. What have you got now?